Diabetes has been a well-recognized disease since the beginning of time. Of the millions of diabetic patients worldwide, one quarter to one half will develop neuropathy over time. Diabetic neuropathy is defined as symptoms and signs of neuropathy in a diabetic patient after other causes are excluded. It is therefore a diagnosis of exclusion. But how does a patient with diabetic peripheral neuropathy present? Typically, patients with diabetic neuropathy complain of numbness, burning, tingling, and pain in the distal parts of their feet and later their hands. Curiously, only about 40 to 50% of patients with diabetic peripheral neuropathy develop pain. Just as baffling is why patients with type 2 diabetes develop neuropathy more frequently than patients with type 1 diabetes. The neuropathy usually presents in a symmetrical and distal distribution, affecting the sensory nerves before affecting the motor nerves. But diabetic neuropathy is not limited to the limbs. It can also affect the nerves that control our bodily functions as well, causing abnormal heartbeats, low blood pressure with standing, abnormal sweating, constipation, slow emptying of the stomach, urinary dysfunction, and erectile dysfunction. The strongest predictors of diabetic peripheral neuropathy are long-standing diabetes and poor diabetic control. There's still much debate as to the cause of diabetic neuropathy. Scientists believe it may be caused by high glucose levels and abnormal blood lipids, which cause the increased production of highly damaging molecules known as reactive oxygen species. These can damage the nerve cells and produce the familiar symptoms. Other possible causes are the buildup of abnormal molecules formed as a result of high blood sugar levels known as AGES or advanced glycation end products. These are harmful to the nerve cells. Still, a third theory is that resistance to the action of insulin in the nerves leads to degeneration and reduced regeneration of nerve fibers. This causes damage to the nerve cells and the surrounding cells that promote nerve conduction, known as Schwann cells. Yet a fourth possible mechanism may involve damage to the tiny blood vessels that feed the nerves in our body. Metabolic changes in diabetic patients can cause dysfunction in the lining of the tiny vessels feeding the nerves in the legs and in other parts of the body. The reduced circulation to the nerves can damage the nerves, causing them to trigger off impulses automatically or with minimal stimulation. Pain that occurs from stimuli that are not normally painful is called allodynia. Despite the ongoing debate as to the origin of this complication of diabetes, one thing is clear. Long-standing diabetes and poor diabetes control are associated with a higher incidence of diabetic peripheral neuropathy. Other risk factors include age, excessive height, obesity, high blood pressure, high cholesterol, smoking, and alcohol abuse. The best way for you to avoid diabetic peripheral neuropathy is keeping your A1C below 7 or as prescribed by your provider, although the benefit is only modest in type 2 diabetes. Finally, remember to check your vitamin B12 level if you're on metformin, since metformin can lower B12 levels and this may worsen DPN or diabetic peripheral neuropathy symptoms. I hope you found this video useful. If you did, like and share with your friends and family. You can support this channel by subscribing. Until the next video, stay healthy and stay safe.